Vitamin D is often called the sunshine vitamin, a nod to its unique place among essential nutrients. Unlike most vitamins, your body can produce vitamin D when your skin is exposed to sunlight. But as we age, our ability to synthesize vitamin D declines, just as our need for it becomes more critical. For seniors, maintaining healthy bones is a central concern, and vitamin D plays a vital role in that mission. So, how much vitamin D should seniors take to preserve bone health and reduce the risks posed by deficiency? Let's explore the science, recommendations, and practical steps to ensure you or your loved ones are getting what's needed for lifelong bone strength. Vitamin D's role in bone health is both fundamental and multifaceted. It acts like the conductor of a well-tuned orchestra, ensuring that calcium, the body's most abundant mineral, is absorbed efficiently from the intestines. Without sufficient vitamin D, even a calcium-rich diet will not fulfill its promise, because the body cannot absorb and utilize the mineral where it is needed the most, inside the bones. This intricate relationship means that vitamin D deficiency can set the stage for a cascade of bone-related problems, including osteomalacia, softening of the bones, osteoporosis, loss of bone density, and a heightened risk of fractures. The problem is not just theoretical. With advancing age, the risk of vitamin D deficiency increases, and so does the risk of bone diseases. Seniors are especially vulnerable for several reasons. Skin becomes less efficient at converting sunlight into vitamin D. Kidneys lose some of their ability to convert vitamin D into its active form. And many older adults spend less time outdoors. Dietary changes, medications, and chronic illnesses can also interfere with vitamin D status. The result is that a significant proportion of older adults worldwide fall short of recommended vitamin D levels. To understand how much vitamin D seniors should take, it's important to first understand what levels are considered sufficient. Blood levels of 25-hydroxyvitamin D, the main circulating form of the vitamin, are typically measured to assess status. Experts generally agree that a blood level of at least 20 nanograms per milliliter, ng/ml, is needed for bone health, though some organizations recommend aiming for 30 EC/NBIL or higher, especially in older adults or those at risk for osteoporosis. How much vitamin D do you need to achieve these levels? The answer depends on several factors, including age, baseline vitamin D status, geographic location, skin pigmentation, sun exposure, and individual health conditions. Still, there are general guidelines to help steer the way. The Institute of Medicine, IOM, now called the National Academy of Medicine, recommends that adults aged 70 and older get 800 international units, IU, of vitamin D per day. This is an increase from the 600 IU day recommended for younger adults. The Endocrine Society, another leading authority, suggests that adults at risk for deficiency may need 1,000 to 2,000 IU per day to maintain blood levels above 30 on IU/ASIL. These are not hard and fast rules, but they provide a framework for most seniors. But why do seniors need more vitamin D? The answer lies in the biology of aging. As we get older, our skin produces less vitamin D in response to sunlight. Kidneys, which convert vitamin D into its active form, also become less efficient. Many seniors spend more time indoors, further limiting their sun exposure. Diets may also be less varied, and conditions such as obesity, diabetes, or gastrointestinal disorders can impair vitamin D absorption. All these factors combine to raise the bar for how much vitamin D is required to keep bones healthy. Let's take a closer look at the connection between vitamin D and bone health. Vitamin D helps the body absorb calcium from the diet. Without enough vitamin D, the body absorbs only about 10 to 15% of the calcium you eat. With sufficient vitamin D, absorption increases to 30 and 40%. Calcium is laid down in the bones, providing strength and structure. If the body does not have enough circulating calcium, it will withdraw calcium from the bones to maintain essential blood levels, weakening the bones over time. This is why vitamin D, calcium, and bone health are so deeply intertwined. Osteoporosis, a condition characterized by porous and brittle bones, is a major health issue for older adults, especially women after menopause. Fractures resulting from osteoporosis, especially hip fractures, can be life-altering and even life-threatening for seniors. Studies have shown that adequate vitamin D and calcium intake can reduce the risk of fractures in older adults. In some clinical trials, supplementation with vitamin D and calcium reduced the risk of hip and other non-vertebral fractures by up to 20%. But there's more to the story. Vitamin D also appears to influence muscle strength and balance, both of which are key factors in preventing falls. Falls are the leading cause of fractures in older adults. Several studies have found that vitamin D supplementation improves muscle function and reduces the risk of falls, adding another layer of protection for seniors. So, how can seniors ensure they are getting enough vitamin D? There are three main sources: sunlight, diet, and supplements. Sunlight is the most natural source of vitamin D. When skin is exposed to ultraviolet B, UVB, rays from the sun, it produces vitamin D3. However, as we age, our skin becomes less efficient at this process. Sunscreen, clothing, darker skin pigmentation, and living at higher latitudes, farther from the equator, can all reduce the amount of vitamin D synthesized from sunlight. In many places, especially during the winter months, sunlight alone may not be enough for seniors to meet their vitamin D needs. Dietary sources of vitamin D are relatively limited. Fatty fish, such as salmon, mackerel, and sardines, are among the best natural sources. Egg yolks, beef liver, and fortified foods, such as milk, plant-based milk alternatives, orange juice, and some cereals, also contain vitamin D. However, even a well-planned diet may provide only a fraction of the recommended daily intake for older adults. For example, a 3-ounce serving of cooked salmon contains about 450 IU of vitamin D, while a cup of fortified milk has about 100 IU. Few people consistently consume enough vitamin D-rich foods to meet their needs, especially if appetite or dietary restrictions are an issue. This is where supplements come in. Vitamin D supplements are widely available in two forms: D2, ergocalciferol, and D3, cholecalciferol. Both can raise blood levels of vitamin D, but D3 is generally considered more effective and longer-lasting. Supplements are inexpensive, safe at recommended doses, and can be tailored to individual needs. For many seniors, a daily supplement is the most reliable way to ensure adequate intake. But can you take too much vitamin D? Yes, it is possible, though toxicity is rare and usually results from very high doses taken over long periods. The upper level intake, the maximum daily amount considered safe, is set at 4,000 IU per day for adults, including seniors. Intakes above this level can lead to high blood calcium levels, which may cause kidney stones, calcification of soft tissues, and other complications. For most seniors, sticking to the recommended 800 to 2,000 IU per day is both safe and effective. Some seniors may need more than the standard recommendations. People with osteoporosis, or those who have suffered fractures, individuals with limited sun exposure, people with darker skin, those who are obese, and individuals with certain medical conditions, such as fat malabsorption syndromes or chronic kidney disease, may require higher doses or prescription-strength vitamin D. In these cases, regular monitoring of blood vitamin D levels and consultation with a healthcare provider are important. Let's take a moment to consider the interplay between vitamin D and calcium. While vitamin D ensures calcium absorption, calcium provides the raw material for building and maintaining bones. The recommended daily intake of calcium for adults over age 70 is 1,200 milligrams per day. Many seniors fall short of this target, and supplementation may be necessary, especially if dietary intake is low. For bone health, vitamin D and calcium work best when taken together, as each supports the other's function. But supplements are not a magic bullet. Lifestyle factors also play a crucial role in bone health. Weight-bearing exercise, such as walking, dancing, or resistance training, helps stimulate bone formation and strength. Avoiding smoking and limiting alcohol consumption are also important, as both can weaken bones. Adequate protein intake, a varied diet, and regular physical activity all contribute to lifelong bone health. What about specific populations? Women are at higher risk for osteoporosis after menopause due to declining estrogen levels, which accelerate bone loss. For postmenopausal women, ensuring adequate vitamin D and calcium intake is especially important, and supplementation may be recommended even in the absence of overt deficiency. Men are not immune to bone loss, particularly after age 70, and should also pay attention to vitamin D and calcium intake. There are also ethnic and geographic considerations. People with darker skin produce less vitamin D from sunlight and may be at higher risk of deficiency. Seniors living in northern latitudes, where sunlight is less intense, are also at increased risk. In these populations, supplementation is often necessary to maintain optimal vitamin D levels. How can you tell if you are getting enough vitamin D? The only way to know for sure is to measure blood levels of 25-hydroxyvitamin D. Routine screening is not recommended for everyone, but it may be appropriate for seniors at risk of deficiency or those with bone health concerns. Symptoms of vitamin D deficiency can be subtle or nonspecific, including muscle weakness, bone pain, fatigue, or frequent falls. In severe cases, deficiency can lead to bone deformities, fractures, and other complications. If testing reveals low vitamin D levels, supplementation is the mainstay of treatment. Doses are tailored to the degree of deficiency, and repeat testing may be done after a few months to ensure that levels have normalized. In some cases, high-dose vitamin D therapy may be used under medical supervision to correct severe deficiency. It's important to remember that more is not always better. Excessive vitamin D intake can have negative consequences, especially when combined with high calcium intake. Hypercalcemia, or high blood calcium, can lead to nausea, vomiting, confusion, and kidney problems. Always consult with a healthcare provider before starting high-dose supplements, especially if you have underlying health conditions or take medications that affect calcium or vitamin D metabolism. The bottom line is clear: vitamin D is essential for bone health, especially in seniors. For most older adults, a daily intake of 800 to 2,000 IU of vitamin D, in combination with adequate calcium and a healthy lifestyle, offers the best protection against bone loss and fractures. Supplements are safe, affordable, and effective when used as directed. Regular physical activity, a balanced diet, and attention to risk factors complete the bone health formula. But bone health is about more than just numbers. It's about maintaining independence, mobility, and quality of life as we age. Fractures can be devastating for seniors, leading to pain, disability, and a loss of confidence. Preventing bone loss and fractures through adequate vitamin D and calcium intake, combined with an active lifestyle, is one of the most important steps seniors can take for lifelong health. Let's recap the key points. Vitamin D is critical for calcium absorption and bone health. Seniors are at increased risk of vitamin D deficiency due to reduced skin synthesis, limited sun exposure, and dietary changes. The recommended daily intake for adults over age 70 is 800 IU, but many experts recommend 1,000 to 2,000 IU per day for optimal bone health. Dietary sources are limited, and supplementation is often necessary. Blood testing can confirm deficiency, and treatment is safe and effective. Combining vitamin D with calcium, exercise, and a healthy lifestyle provides the best defense against bone loss and fractures. If you're a senior, discuss your vitamin D and bone health needs with your healthcare provider. Ask whether you should have your vitamin D levels checked, especially if you have risk factors for deficiency or a history of fractures. Review your diet and consider whether a supplement is appropriate for you. Remember, maintaining bone health is a lifelong process, and it's never too early or too late to start. In the journey of aging, strong bones are the foundation for an active, independent life. With a little attention to vitamin D, calcium, and healthy habits, you can build and maintain that foundation for years to come. Make vitamin D a part of your daily routine and take steps today to ensure a healthier, stronger tomorrow.